Hi, my name is Tiffaney Marlow and I'm a registered physiotherapist at Proactive Pelvic Health. Today I'm going to talk to you about Diastasis Rectus Abdominus. I think this is one of the most common questions that most of my pregnant or postpartum patients come in asking about is how to prevent mummy tummy, or what we call a Diastasis Rectus Abdominus. Most of my patients are very keen to get back to their exercise and particularly their core strengthening after having a baby. So what is diastasis? Diastasis is the separation of the six-pack muscles, or your rectus abdominis, that run from your sternum all the way down to your pubic bone. So when this happens is as the baby's growing in our belly, those muscles only have a certain capacity for stretch. Once they go beyond that, we actually start to have thinning of the little piece of connective tissue that holds those two sets of muscles together. This little piece of connective tissue is called your Linea Alba. So as we get bigger, particularly in our third trimester, that little piece of connective tissue starts to thin and actually separate, and we get a small separation of the rectus abdominis muscles. Now, research actually finds that most women in their third trimester will have some degree of separation. So it's very normal, but using some of the tips and tricks that I showed you before about proper biomechanics during pregnancy can help to prevent worsening of that diastasis. Now, after your vaginal delivery or your C-section, there's about 8 weeks that these muscles have an amazing capacity for self-healing, where they actually start to come back together as all of the tension in the abdomen starts to change during that postpartum period. Now, if you're concerned about still having a diastasis rectus abdominis, there are ways that we can assess for it, and we should identify and assess for this diastasis because it can inhibit your ability to control those deep inner core muscles. So today I'm going to show you how it is that we assess for the diastasis rectus abdominis during our pelvic physiotherapy assessments. So we assess the Linea Alba, which is the little piece of connective tissue I was talking about, from your sternum all the way down to your pubic bone. And what we're feeling for is good tension along that space. It should feel kind of like a trampoline. And if you notice that there's certain spots where you can dip further down, then we might be considering a diastasis. After we do that, then we assess for the diastasis actively at 3 different points. So one is just above the belly button. So we'll push our fingers down and we'll have you lift your head, looking for a separation. At the level of the belly button, we do the same thing. And then just below. So if you think you have a diastasis rectus abdominis, come on in. Our pelvic health physiotherapist can help identify it and can help to give you some exercises to strengthen that deep inner core, to create tension in your linea alba and get you back to doing your exercises as soon as possible.